Hello viewers, today I thought I should talk to you about cholesterol and the other elements in the cholesterol which are supposed to be bad elements. That is what most of the doctors say, but many of the patients keep thinking about it as bad, whereas it has got a lot of very good features and which is essential for the well-being of a human being. Especially cholesterol is so essential. It's one of the lipids or fats which is so essential for the well-being of the human being, because it produces hormones. It has got so many features which are essential, especially for children. So what are the doctors usually say what is good cholesterol, what is bad cholesterol. So what are the food items that you can take, what are the food items you should not take, and what are the latest advisories which have come from various parts of the world in the recent past. So if you consider the good and bad cholesterol, we have high density lipoproteins, low density lipoproteins and very low density lipoproteins. These are all different parts of the total cholesterol. So HDL is something which is good for the heart, which is always healthy cholesterol, and when it is in low numbers, it is said that it does not protect the heart. If it is in higher in numbers, it has got a protective effect in the body. Whereas LDL or low density lipoproteins are bad cholesterol which have a feature of coating the inner lining of the blood vessels, which in the latter part of the life can get dislodged and cause symptoms of stroke and also certain conditions like cardiac problems. So to prevent this, we are supposed to keep our LDL cholesterol or low density lipoproteins in the lower level. And another part of the lipids is triglycerides. Triglyceride is something which is directly related to the food. So triglycerides is raised immediately after taking a meal. So the age-old dictum was that the cholesterol should be measured in fasting state, preferably 8 to 10 hours. Now recent indications are that, and after several research, it has been proved that it need not be on purely fasting state the patient has to give the blood for testing. It can be on a full stomach or even after a light meal. And when in case the triglyceride level is more than 400, we are supposed to retest only the triglyceride part after a overnight fasting of about 8 hours. So these are the newer additions to the testing of cholesterol. So looking into the different types of foods which can increase the cholesterol, yellow of an egg, in the non-vegetarian group it is mutton and also beef and the pork. All these are items which are otherwise also called as red meat. They have a tendency to increase the LDL cholesterol, thereby it is better to avoid. Whereas more of fiber containing fruits and vegetables, they are extremely good and they are not digestible fibers and they have a power of drawing out the cholesterol which is usually found in the intestines and then throwing them out. So adding a lot of fruits and vegetables in your day-to-day life is always better, and non-vegetarian food in moderation. Whereas these days, according to a recent study which was done in India, it is said that even 1 teaspoon of liquid ghee can be used every day, which is not harmful to the body. Same way, eggs also can be used in restriction, of course, not freely, like 3 or 4 eggs per day is not allowed, and white of an egg is definitely better, and yellow of an egg maybe 1 to 3 per week is allowed. Going by how the metabolism happens, though there are people who say I don't eat anything much, still my cholesterol is high. The reason is genetically it is predetermined that you are having this a certain amount of cholesterol. The reason is the cholesterol that is being added up every day from the diet, or which is already circulating in the body, that particular cholesterol gets excreted from the liver through the bile into the intestines, and from the intestine it gets back into the circulation. So there are medications which are available, which are used for either reducing the cholesterol by certain pathways, or even by reducing the absorption of cholesterol from the intestines. So this is how the treatment of cholesterol is done. And recent past there have been lots of news that cholesterol is good and no need of people taking medicines, but this is highly controversial. As of now, the medical fraternity does not say yes or no to it until further probes are done onto these facts. It is not advisable to stop the usage of anti-cholesterol drugs, specifically statins. Regarding statins, we have different types of statins. In the recent past usage of statins, we have in common products which are simvastatin, then that is atorvastatin, and also rosuvastatin. So excepting simvastatin, which is supposed to be a drug which can be used only in the nights, in case of atorvastatin and rosuvastatin, it can be used any time of the day, maybe in morning, afternoon or night. And out of all this, rosuvastatin, milligram by milligram, if you take rosuvastatin 5 mg is equal to 10 mg of atorvastatin and then 20 mg of simvastatin. So milligram wise, I don't think when the doctor writes a prescription to you, you should bother about it. And then there are certain side effects for these drugs which are in fact sometimes doubted by the doctors when they prescribe, and those side effects are very rarely seen in people of India, whereas in white skinned people it is very common. So there is nothing to worry about continuing statins, and statin is almost one of the largest used drugs in the world, and it is also safe to use statins as of now. Thank you.